If you understand depression not as a disease, not as a thing that people have, but as a way that individuals react to their lives, then the most important thing is to help someone to identify what's gone wrong in life, what they need to change. But the other part of the conversation has to be to manage this medical framework that we have constructed around these situations. The first thing I think is to say to people that some people in your situation might say that you're depressed or give you a label of depression. And then I would explain to people that this is a label. It doesn't imply that we know anything about what's going on in your brain. And indeed, we don't have any evidence about links between depression and brain chemicals or any other brain mechanisms. And I would also explain to people that although some people find these labels to be helpful, some people find them to be unhelpful, and there's some evidence that labeling people can lead to bad outcomes in itself, because it can be a sort of self-fulfilling prophecy. And then I would have a similar conversation about the use of antidepressants. I would have a conversation that goes along the lines of, many people would suggest that you should be prescribed an antidepressant in this situation. And some people think that the evidence shows that these are beneficial. My view is that the differences between antidepressants and placebo are small. There is no evidence that these are targeting or rectifying any underlying chemical imbalance or any other process that's going on in your brain. They are drugs that do change your brain, and that does come with possible negative consequences and can have harmful effects on your health in the future. They are drugs that do seem to numb emotions through the alterations they produce in your brain. Some people might find this to be helpful. Some people find it unpleasant. If you think that it's something that you really need to do, having been informed about all the adverse effects that might come along with it, then I would always be advising people to take antidepressants at as low a dose as possible for as short a time as possible.